Can you see the screen? The peritoneum urinary bladder slide.
Yes. Yes.
Okay, okay, thank you.
Doctor, can you send the lecture?
Okay, Bismillahirrahmanirrahim. So here most of the things are repeat for you. You already know. So today we are going to see about mainly about the
Doctor,
urinary gland. Yes.
can you send lecture, please?
Okay. Okay, I have sent it to Hadil. Did you receive? Okay. So we know already how the pelvic peritoneum is arranged. Okay. What are the parts of the ureter? Did you study the ureter in the last lecture along with the kidney? Then we have the urinary bladder, urethra, and prostate. Okay, so about the ureter, you already know that it is a muscular tube around 25 to 30 centimeter. Okay, its upper end is dilated to form the pelvis. Okay, then it is lying over the some important muscles over the posterior abdominal wall. So what happens when the ureter enters into the pelvis? Okay, so above the ureter have same course for male and female, but in the pelvis, male ureter it goes in different course than with the female. So first of all, the male ureter, it will enter into the pelvis by crossing the bifurcation of common iliac artery. Now we know it here we have the common iliac artery which divides into internal and external iliac artery. So at this point, at the bifurcation, it will enter into the pelvis. Then after that, you can find that it is going along with the internal iliac artery. Okay, it is in front of internal iliac artery. Now near the termination, this is urinary bladder. So when it will terminate into urinary bladder, it is crossed by one of the male reproductive organ that is called as vas deferens. So this green, it is a vas deferens tube, and this is ureter. Okay. Now what about in females? So in female also it will enter into the pelvis same way, okay, in front of the internal iliac artery. But here you can see it is very closely related with the ovaries. Can you see this is the ovary, this is the urinary, this is ureter, and this is internal iliac artery. So it runs behind the ovary. Then it reaches to the ischial spine. This is the ischial spine. Okay, and beneath here. So now we know already the anatomy of the uterus. We know what is the broad ligament. So at beneath the base of broad ligament, it is crossed by uterine artery. Can you see? This is the uterine artery and this is ureter. Okay, and here also you can see this is the broad ligament, and here you can see this is the section, cross section of the ureter, and this is uterine artery. So this is the way the uterine artery it is crossed by ureter. Okay, so in male you have to remember that it is related with the vas deferens near its termination, but in female, it is related with the uterine artery. So in male pelvis, again we have the peritoneum, which will be covering the rectum. So we know already the rectum has three parts of peritoneum. The upper part will be covered from the in front and sides as well. The low middle part will be covered from in front. Then this peritoneum, it will be reflected over the urinary bladder, and here it will be forming a pouch which is called as, what is this pouch called as? Yes,
A
and
vesicle pouch.
very good, it is called as rectovesical pouch, and from here this peritoneum will be reflected over the here or the anterior abdominal wall. So now we have to focus on our organs of reproduction here also. So this is urinary bladder. At the neck of the urinary bladder, you can find there is a gland which is called as prostate gland. And we can see the urethra is passing through the prostate. Then the urethra has a small course in the perineum. Then it is entering into the penis. Okay. Then what else you can see here? You can see that this is the scrotum. In the scrotum, there is the testes. Okay, this already we have seen in life cycle. So along with the testes on the posterior medial aspect, we have the epididymis. From the epididymis, we have the vas deferens, okay, or ductus deferens, which is present inside the spermatic cord. And now you can see it is going into the pelvic cavity. Then it will be opening, okay, here on the posteriorly. So now you can see posteriorly you have one more organ which is called as seminal vesicle or seminal gland. What else you can see here? You can see the bulbourethral gland. You can see the ejaculatory duct. Okay, now we will see one by one. This is female. So again, we know the pelvis, the peritoneum will be reflected from the rectum to the uterus, posterior surface of the uterus, forming a pouch which is called as rectouterine pouch, okay, or pouch of Douglas. Then after that, the peritoneum again will be reflected over the superior surface of the urinary bladder, which is again forming another pouch called as vascular pouch. Okay, so here again we can see that there is a ovary, okay, and uterine tube. This is the male and female, so we have studied this many times. This is the reflection of the peritoneum, which is forming the rectouterine and rectovesical pouch. Now we have the urinary bladder. What is the location? So it is behind the pubic symphysis. So now in adults, it is considered as the pelvic organ. But in infants, due to narrow pelvis, it will be an abdominal organ. The position of the urinary bladder, it is higher in male. As we can see in the all picture, it will be little higher because there is a presence of the prostate gland in the at the neck of the bladder. What is the shape? So shape, as we know, it is like a balloon. So according to the amount of urine, its shape and relation may vary. Okay, when it is filled with the urine, it may reach even till the abdominal region. Okay, it may reach to the hypogastric region. And if it is empty bladder, you will consider as the pyramidal in shape, like this. If it is full like balloon, it will become oval in shape. Its capacity is around 500 ml. Okay, and it is according to person and person, it may vary. What are the different parts? This part, it is considered or it is known as apex. Okay, this is the apex. And this posterior surface, it is called as the base. or fundus or posterior surface. This is the superior surface over which we have the reflection of the peritoneum. And on the sides, we will have the right and left inferolateral surface. This is neck. Okay, so here you can see this is the empty bladder in the pelvis, and then when it is full, it will raise into the abdominal cavity. So here we have the apex, base, superior surface, inferolateral surface, neck. So what do you think anterior surface relation? So obviously it is related with the pubic symphysis. Now there is something very important you can see in every picture. They are showing that apex has some ligament which is known as median umbilical ligament. Okay, what is this? Median umbilical ligament. Okay, so it will be attached from apex to the umbilicus. Okay, so when you will study the embryology, you will find it is a remnant of urachus. Okay, what is the urachus? So urachus, it is the remaining of allantois that will drain the urine to the umbilical cord. So in the when the baby is in fetal stage, in developing stage, this is open. Okay, this part will be open and it will be connected to umbilical cord, because that time the urethra is not working, so the urine will be drained through this route. Okay, it is allantois, and in adult it will disappear to become median umbilical ligament. Next we have the posterior surface. So posterior surface also very easy. It will be related to the vagina in the female. Okay, and here if you see in the here posteriorly in male, you will see that it is covered with the peritoneum and it is a pouch called as rectovesical pouch. Okay, and the lower part, this is the urinary bladder, so this will be the lower part. This is upper part. So upper part has a pouch, and the lower part, it has no peritoneum, but it is related with the seminal vesicles like this, seminal vesicles, and also the vas deferens. This is the posterior surface of the bladder. Here you can write, this is the posterior view of urinary bladder. What about the superior surface? So superior surface, obviously it will have the coils of the ileum, sigmoid, colon, okay. And in female also there is the uterus. Inferolaterally, so inferolaterally we know that there will be the pelvic diaphragm. It is in the perineal region, tahat. So you have the levator ani muscle below and then obturator internus muscle above here. Then we have the neck. So where is the neck? This one. Okay, so the neck is the most fixed part of the urinary bladder. In male, it will be resting over the prostate gland here. Now, if you see, if you take the section of the urinary bladder, you will find that the wall of the urinary bladder has a smooth muscle. What is that muscle called as? Detrosal muscle. Okay, and this mucosa of the urinary bladder, it will be thrown into the folds. These folds are called as rugae. Okay, what are these folds called as? Rugae. But if you see this area, which is compared to the other surface or rugae, this will be flat or this will be smooth. Okay, it is called as the trigone. Okay, so if you open the bladder, you will see two parts. One, the mucosa will be thrown into folds called as rugae. Then in the lower part where you have the opening of the urethra and the openings of the ureter, it will make a triangle, and this triangular area, it is smooth. It is called as trigon. Clear? This is a smooth trigon. These are the folds called as rugae. This is the blood supply of the urinary bladder. So there we have the superior and inferior vesical artery, which will be branches from the internal iliac artery. Okay, but only in female you will find here that the inferior vesical artery, it is replaced by the vaginal artery. The veins will be by the vesical venous plexus, which will be present on the inferior-lateral surface. Okay, it has a where you can see here the venous plexus, this blue veins, which will drain into internal iliac veins. What are the lymph nodes? They drain into external iliac lymph nodes, okay, or some may go to internal iliac also. Now, what is the nerve supply of the urinary bladder? Okay, so in today case, what differential diagnosis you put for urinary bladder? Yes, can anyone tell me what were your differential diagnosis for urinary bladder in today, in the case of the uh,
In urogenic bladder?
yeah, most of you have put the neurogenic bladder. Okay, so just give some time to yourself to see what is neurogenic bladder. Okay, there is a automatic bladder word also known as. Okay, so you, when you will study, you will come across. So we have the nerve supply through the inferior hypogastric plexus. Okay, so this is very very crucial, very very important. Okay, and if you have any patient of cerebrovascular episode or paralysis, you first thing you will find that they put the catheter. Did you see any patient who has paraplegia, okay, or hemiplegia? So the first thing they put the catheter, because the patient generally they lose the control of urine. So this nerve supply is very important, which is through the inferior hypogastric plexus, parasympathetic and sympathetic. So parasympathetic is through the S2, S3, S4. Okay, sympathetic through lumbar. What is the function of the parasympathetic? They will stimulate the contraction of the detrusor muscle, okay, and inhibit the action of the internal urethral sphincter or sphincter variety. So it means this is the nerve of emptying. Okay, when you want to empty the bladder, you have parasympathetic activation. Okay, but the sympathetic, it is a nerve of filling. Okay, because it will close your internal urethral sphincter and your detrusal muscle will be relaxed. So this is called as nerve of filling, because it will fill your urinary bladder, and this is called as nerve of emptying, because this will be activated when you want to empty the bladder. So we have the urethra. So urethra, if you see female urethra, it is shorter, and the male urethra, it is longer in length. Okay, in male urethra, it is not straight, it has a double curve. Okay, you will find it as a double curve. The length is about 18 to 20 centimeter. From where it will start? From here. It has the internal urethral sphincter or orifice. Okay, from here it will enter into the prostate, then it will go into the urogenital diaphragm, then into the penis, bulb of penis, and finally it will open into external urethral orifice. So from internal to external urethral orifice. It has four parts. This small parts, it is called as internal urethral sphincter. So this is pre-prostatic part, which has the sphincter. Then we have the prostatic part, which is inside the prostate. Okay. Then we have the membranous part, okay, which is inside the perineal membrane. In some books, they don't consider the preprostatic part as a separate. Okay, generally they will tell it has three parts: prostatic, membranous, and penile or spongy. Okay, so don't worry if we consider some standard book which say that there is a small part which is the preprostatic part. So it will be from the neck to the base of the prostate. It is surrounded by the smooth muscles which will form the internal urethral sphincter. Okay, so this sphincter, it is called as sphincter vesicae. Okay, sphincter vesicae. It has your control. It has involuntary control. Okay, it has involuntary control. Okay, so what will be the function? So obviously it will maintain the urinary continence, and also is in male it has a sexual function also. So it will prevent the retrograde flow of seminal fluid into the bladder. Okay, so because it will be closed, so the seminal fluid, it will go like this. It cannot go inside the bladder. So now if you see the prostatic part, it is about 3 to 4 centimeter. It is wide and more dilatable part. Okay, it will receive the opening of the ejaculatory ducts. Okay, and it is inside the substance. So you can see this is a prostate gland, two lobes, and in between this is urethra. So now we can see we have many models like this. So we can see all the relations. But if you see very carefully, you will find that the prostatic urethra has some little details. Okay, it has some fine details. First of all, you have the urethral crest here. Okay, I think the this side has moved. So this will be the crest. Okay, and then on the sides of the crest, like here, we have small openings. Okay, depression on both sides of the crest like this. So at this sinuses you will get the opening of the prostatic duct. So prostatic duct is not only one or two, there are multiple small ducts which opens into prostatic sinus. Then on the crest you have the colliculus seminalis here, okay, which has elevation. So this one, which has prostatic utricle and two ejaculatory ducts. So now you will ask, what are these ejaculatory ducts? So these ejaculatory ducts here, this is ejaculatory duct. So here you can see it is formed by two structures. One, what is this? Vas deferens. Then seminal vesicle. So at the posterior surface of the urinary bladder, the seminal vesicle and vas deferens, they will join to form ejaculatory duct. Okay, which will open on the colliculus seminalis. Then what about this prostatic utricle? What is this? So this prostatic utricle, this is nothing, not functioning, just it is a analog of uterus and vagina in female. Okay, so embryologically when you see this part will be formed as the uterus and vagina in female. But in male it will remain like a small projection which has no important function. Okay, so we don't have a specific model like showing this detail, but here I will show you. So this is the urethral, sorry, from here, this is the urethral crest. Okay, On each side, you will see multiple openings of the prostatic ducts. This is called as prostatic sinus. And here, this is area which is called as colliculus seminalis, which has a prostatic utricle and two ducts. So you should know what is prostatic utricle. Okay, you should know what is ejaculatory duct. Then we have the membranous part. So in the membranous part, this is least dilatable. Okay, it is a little bit narrow part. So it will extend from the prostate. Okay, so this is the prostatic urethra. So this will extend from prostate to the bulb of penis. It will be present inside the perineal membrane. Okay, again there is one more sphincter which is called as external urethral sphincter or sphincter urethrae. Okay, so this one, it is the sphincter vesicae. This is the sphincter urethrae. Okay, and it is under our control, voluntary control. Okay, so that we can make the urinary continence if we pass the urine or not. Okay, a pair of pulbourethral gland, okay, which is beneath the sphincter urethral muscle. It will pierce the, you can see it is piercing the perineal membrane. Okay, this one, so these are the pulbourethral gland. It pierces the our membrane, perineal membrane. Then we have the spongy part. So it is about 15 centimeter in length. It will extend from membranous to external urethral orifice. Okay, it has two parts. This is called as bulbar part, which is inside the bulb, and this will be the penile part, which is inside the penis. So bulbar part, it will be in the bulbospongius. If you remember, in the perineum or in the life cycle, you study corpus spongiosum, bulbospongiosum. So this is the corpus cavernosus and this is the corpus spongiosum. So corpus spongiosum has the opening of the urethra. Okay. Then we have the penile urethra. Then its terminal part here, you can see it is dilated part in the glans penis. Okay, it is dilated in the glans penis or navicular fossa. In female urethra, it is about 4 centimeter. Okay, same way it will start from the neck of the urinary bladder and it will end into the external urethral orifice here. It has the external urethral sphincter. Yes, it will receive the opening of the paraurethral glands. Now in bladder, how many sphincters you saw? So you have the internal urethral sphincter. This is between the neck of the bladder and prostate. Okay, it is in the pre-prostatic part. Okay, and it is involuntary in action. Always remember, it has a smooth muscle, involuntary in action. External, it is present here into the deep perineal pouch, okay, into the urinary urogenital diaphragm, and it is surrounded by the skeletal muscle. Okay, and it has voluntary control so that we can control the urine. Now we have the prostate gland. So when you go to the mashra, you will find we have many models showing the prostate gland. This is the location. It is a single fibromuscular gland which is around the prostatic urethra. Okay, so as we know, the length of the prostatic urethra is 3 to 4 centimeter. So length of this is also 3 centimeter. Okay, and it is related above with the neck of the urinary bladder, and below it will be related with urogenital diaphragm. Okay, so what will be the function? So it will secrete thin milky fluid, okay, and it is added to the seminal fluid at the time of ejaculation, which is rich in citric acid and acid phosphatase. Okay, it will help to neutralize the acidity of vagina. What will be the relation? So this is superior, this is inferior, this is anterior, this is posterior. So what is superiorly? So superiorly we have the neck of the bladder. So superiorly we have the neck of the bladder. Okay. Inferiorly we have the urogenital diaphragm. Anteriorly we have the pubic symphysis, and also there will be a ligament which will be attached from prostate to the symphysis pubis. Posteriorly, we will have the rectal ampulla, and also there will be a membrane called as rectovesical membrane here. Laterally, we have the muscle of the pelvic diaphragm called as levator ani. So the prostate, the lobes of the prostate, very important because histologically, if you see, they have the some different features. So anatomically, we have the anterior lobe, this one, which does not contain glands. Okay, they are present in front of the urethra, and it will connect the right and left lateral lobes. Then this is the posterior lobe. So posterior lobe, you can see it is between the ejaculatory duct and the urethra. Between the ejaculatory duct and urethra. Then you have the median lobe. Okay, median lobe, this one. The median lobe, which is present between the, you can see between the urethra and two ejaculatory ducts. This, and this area is very important to know because this is the area which is very prone to get enlarged. So you can imagine if it enlarge, it will enlarge in upper direction. Okay, which can obstruct the flow of urine like this. Then we have the right and left lateral lobes which are present on either side of the urethra. So what are the structures that will support the prostate gland? So first of all, the ligament which will attach from the prostate to the pubic symphysis, and another is the muscle which is a part of levator ani, which is also called as the levator prostate. Okay, also called as levator prostate, this muscle. What is the blood supply for this? So because it is at the neck of the urinary bladder, so it will receive branches from the inferior vesicle, middle rector, and internal pudendal arteries. Then what is important about the veins? So we have the prostatic venous plexus. Okay, it lies outside the capsule. Okay, so this is the capsule. So it is outside the capsule, and it will drain into the internal iliac veins. Okay, this is very important to know because in today's case you saw that there is hypertrophy of the prostate. So can you do the surgery for this? If you do the surgery, what are the veins and arteries you have to ligate? So the nerve supply will be from the same inferior hypogastric plexus. So sympathetic will stimulate the smooth muscles for the ejaculation. Okay, lymph nodes, internal iliac lymph nodes. So as just now we saw that any enlargement of the prostate, so mainly which lobe will be involved, will be enlarged? Median lobe. Always remember a median lobe is more prone for enlargement, and it will enlarge in the upper direction. Okay, so now you can imagine if it is enlarged, this part of the bladder, this urine will not be able to drain like this. So it will be always there. Okay, pouch of stagnant urine. So this is the cause that the patient will go past the urine, but he will have the feeling of incomplete voiding. He will feel no, he did not micturate completely. Why? Because there will be, in chronic cases, there will be formation of the pouch of urine, okay, which will not be able to clear like this because there will be a enlarged median lobe. And another thing is that this stagnant urine will be the cause for the infection. Okay, the person will present to you with the repeated urinary tract infection. Okay, so the prostatic enlargement, enlarged median lobe, may affect all or part of the prostate. It may be benign or malignant. Okay, it is generally uh, we consider benign hypertrophy, but it could be a malignant condition also. So we have to examine, when you will examine through the, in the last lecture also we saw that through the digital rectal examination we can examine the prostate, the surface of the prostate. So the surgeon can feel the surface of the prostate, if it is smooth or if it is irregular or if it is hard. Okay, so here we finish. Any questions? I try to finish little early as we have, I think, just short time. So inshallah, it is easy chapter. We have models for the urinary bladder, like the posterior. We have the section of this, this like this also. Okay. Then we have the section of this also, the posterior surface of urinary bladder. We have the model, which is a vas difference and seminal vesicle, which will join to form ejaculatory duct here, which will open into the prostatic urethra. Any questions? What is the trigone? Okay, what is the muscle of the urinary bladder known as detrusor? Okay, so I believe inshallah you understood everything.
Yes, thank
Or
you.
you did not, you did not understood, or you understood everything, or
I
50-50.
understand. No, doctor, it's clear.
It's clear. Okay, okay, thank you so much. Inshallah, see you in Mashra. Okay,
Thank you.
we will have embryology lecture tomorrow, inshallah. Okay, thank you so much. Good luck.